Hello, my name is Daniel Gundersen. My pronouns are he/him, and I'm a nursing student from Elmhurst University, and I will be help your nurse/doctor provide your care today on our telehealth call here. May I please have your name and date of birth?
Lauren Lehman, May 2002.
Perfect. And what are your pronouns? What do you prefer to be addressed by today?
She, her.
She, her? Perfect. What brings you into the hospital today or our telehealth communication call? What can I help you with today?
I have back pain and a headache.
Back pain and a headache? Okay.
hmm
Have you ever experienced pain like this before? Is this a usual health or a chronic health condition that you've experienced in the past?
No.
No? Okay. So you've been previously healthy?
Yes.
Okay. Um, we're gonna go. So you're reporting back pain and a headache, and you said previously you've been healthy, so this is a pretty new symptom to you.
Yes.
Okay. Um, So now I'm going to get into our old carts analysis, and I'm going to go ahead and ask you a few questions regarding your back pain and headache. Onset, when would you say this headache and back pain started happening to you?
Um, a week ago.
A week ago? Okay. Is there any specific location where this back pain is causing more stress or pain than regular, or is there just any location that it might flare up?
My lower back.
Lower back? What
hmm
about location wise in the environment? Is
No.
any particular physical activity or draining activity that induces it
No.
as well with your headache? No.
No.
Okay. How long would you say these symptoms last, this headache and this back pain? Or is it
Um,
active?
3 to 4 hours.
3 to 4 hours a day?
hmm
Okay. Um, Could you name any characteristics or significant negative factors that associate with this back pain or headache, other than obviously those two symptoms?
Um, my headache, it's more of a dull pain all the time. And yeah, that's about it for that.
Okay. Are there any alleviating or aggravating factors for either of these two symptoms?
No,
No? Okay. Are there any other related symptoms that you seem to be noticing with these, or just those two?
not that I noticed. No.
Okay. Have you tried any treatment at home or any home remedies or any medication?
Ibuprofen.
Ibuprofen? And then on a scale of 1 to 10, what would you say the severity is?
Probably a 6.
A 6? Okay. Um, Before we start off any of our history diagnoses, I'm gonna for an unrelated words test, I'm gonna ask say to you 4 words, and I want you to remember them, and in a few minutes I will ask you to recall them, and at the end of our meeting here, I will also ask you again to recall them. So
Okay.
the 4 unrelated words are dog, water bottle, remote, and plant. Do you need me to repeat those?
No.
Would you like to say them?
Dog, water bottle, remote, and plant.
Perfect. Okay. We're going to go ahead and get into our neurological history. So you said you were experiencing headaches. You said it was a dull all the time pain.
Mm-hmm.
Does that sound about right?
Yep.
Fatigue?
No.
No fatigue. Dizziness?
No.
Neck pain or stiffness?
No.
Pupil size changes?
No.
Problems with sense of vision, hearing, taste, smell, or sensation?
No.
Impaired coordination?
No.
Impaired movement, weakness, and or paralysis,
Mm-mm. No.
involuntary movements or tremors,
No.
change in posture or gait,
Not that I know of. No.
not with the back pain,
No.
no. Chewing, swallowing, or choking problems,
No.
no. Articulation of words, speaking clearly.
Sometimes, yeah.
Okay. Could you articulate on that?
I'll mumble or forget a word that I'm saying.
Um, Articulation of words is speaking clearly. So you
Yeah,
speak
mum.
clearly,
Yeah, sometimes I mumble.
but the articulation of words is being able to speak clearly all the time. So
Then yeah.
no.
Then no, yeah. No.
Okay. Okay. Aphasia, understanding of expression.
No.
You don't understand other people's expressions.
No, I do. I don't exhibit that.
Impaired control of elimination.
No.
Change in level of consciousness.
No.
Impaired short or long-term memory.
No.
Altered ability to carry out normal activities or daily living.
No.
Alteration in sleep patterns.
Sometimes my headaches make it harder for me to fall asleep and stay asleep.
Okay. Altered effect.
No.
Altered mood.
No.
Problems with anxiety.
No.
Change in orientation.
No.
Memory problems.
No.
Problems with decision making or managing money.
No.
History of TIA, transient ischemic attack or stroke.
No.
History of head injury, spinal cord injury, loss of consciousness, syncope, or seizures or dementia.
Mm-mm.
History of brain, spine, or peripheral nerve surgery.
No.
Family history of Huntington's disease, Tay-Sachs disease, intellectual disability, or a learning disability.
No.
Okay. We're going to go ahead and get into your mus musculoskeletal history. Um, we're going to start off with, do you experience any pains, cramps, or symptoms or stiffness?
No.
Uh, musco musculoskeletal deformities,
No.
decreased joint range of motion,
No.
joints locking up or giving away,
Mm-mm.
edema, redness, warmth, or tenderness in the joints,
Nope.
crispations in the joints, crackling sounds,
No.
weakness or an atrophy,
Nope.
history of sprains, fractures, arthritis, or an injury,
Nope. Nothing. None of those.
limping or favoring an extremity,
Mm-mm.
arthritis, osteoporosis, or gout,
No.
history of falls,
Nope.
back pain, stiffness, or decreased motion.
Yes.
Could you describe that? Is it, you said it was your lower back. Is it stiffness? or decreased motion?
Yes, yeah, it's both.
All the above. Okay. Next we're gonna go ahead and get into a neurological assessment, and we're gonna begin with appearance and behavior. So, we're gonna start with level of consciousness. So, uh, I guess I'm gonna ask you what you would say your level of consciousness is. Or is it spontaneously, to name, to a loud voice, to pain with an appropriate response, to pain with decorate response, to pain with cerebrate response, or no response to painful stimulus?
Pain with a appropriate response.
So spontaneously?
Mm-hmm. Yeah,
Okay. Facial expressions. Would you say you appropriately um show facial expressions to situations or non-appropriately to situations?
appropriately.
Okay. Next, we're going to get into speech. Speech quality. Would you describe your speech quality as clear, difficult to understand, or slurred speech?
Clear.
Would you describe your speech pace as appropriate, fast, or slow?
I would say appropriate.
Appropriate. Would you coordinate your speech volume to adequate, soft, or loud?
Adequate.
And with speech, do you find an appropriate way to find words, a difficulty finding words, expressive aphasia or receptive aphasia? Appropriate?
Mm-hmm.
Okay. Next, we're going to get into cognitive function. I'm going to ask you a few questions and I just want you to answer them, and they're pretty easy. First, we're going to start with time. What day is it of the week?
Tuesday.
Perfect. What month is it?
September
What year is it?
2024.
Okay, next we're gonna get into place. Where are you?
My room.
And next is person. What is your name?
Lauren.
Okay, I describe your orientation as a 4. Would you describe your attention span as adequate or short?
Adequate.
Adequate. Are you able to perform simple calculations, or do you struggle with being able to perform simple math calculations?
I'm able.
Cool. Um, Now I'm going to ask you to recall those 4 words that from the recalled word test, and I want to see if you're able to tell them back to me.
Dog, water bottle, remote, and plant.
Perfect. Um, are you able to follow commands or are you unable to follow commands?
Follow.
Follow. Um, Reading, are you able to read a sentence and explain it? Able to read a sentence but unable to explain it? Or unable to read or explain a sentence?
Able to read and explain it.
Are you able to write?
Yeah.
Yes. What would you do if an addressed envelope was found? Would you be able to demonstrate appropriate judgment in response to a situation, or would you not be able to appropriate judgment?
I wouldn't be able to.
You wouldn't be able to?
I would be able to.
Oh. Next, I'm going to ask you an analogy, and I just want you to finish the analogy for me. A dog is to a puppy as a cat is to a blank.
Kitten.
Perfect. So you're able to complete the analogy. Okay. Next, I'm going to ask you an abstract reasoning, and I want you to be able to explain the deeper meaning of the statement. The early bird catches the worm. What does that mean
Um,
to you?
the earlier someone gets up, they have more time in the day and more productivity.
Yeah. Okay. So you're able to understand the deeper meaning of the statement. Perfect. And next, we're going to get into select cranial nerves. So first, we're going to start off with the CN7 facial nerves. So I want you to be able to smile, frown, show your teeth, wrinkle your brow, puff out your cheeks, and whistle. So we'll start from the top. Can you smile for me? Perfect. Can you frown? Okay. Can you show your teeth? Sweet. Can you wrinkle your brow? Yeah. Can you puff out your cheeks? And can you whistle?
I don't know.
No whistling. That's okay. But I would say your facial movements were pretty symmetric.
Okay.
Next, we're going to go on to the CN8 acoustic nerve hearing. So for this, I'm going to have you turn each of your ears towards the speaker and elude the other ear. And I'm going to try to test if you're able to hear in each of the ears with the other ear eluded.
Okay.
If you could please point the ear that isn't being covered up completely towards me, I would appreciate it. Can you hear me clearly?
Yeah.
Perfect. Other side. Can you hear me clearly?
Yeah.
Perfect. So you can hear me perfectly on both sides. I'd like to ask you again, if you could please repeat those four unrelated words that I had asked you previously once.
Um, dog, water bottle, remote, and plant.
Perfect. Is there anything else you need from me today in terms of today's call?
No, I'm good.
Do you have any questions or concerns from today's telehealth meeting?
Nope.
Okay, well, I believe I'm about to leave the room and your nurse or doctor will be in shortly to help assist you with your headache and back pain.
Okay, thank
For
you.
your time today.
Thank you.
Okay, now we are going to work on the CN9 and the CN9 glossopharyngeal and 10 vagus nerves. So I am going to kind of try to look in the camera here. uh, 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 okay. Well, I'd say everything looks pretty symmetric and elevated to me. No hoarseness feeling to me or difficulty swallowing at all here. So that's what I'm gonna put for that one. And then for the next one, the CN12, I'm gonna I got a symmetrical tongue line and able to push against resistance. Well, thank you for your time today. I believe that is the end of the recording.